Hey guys, so in the last lesson we talked about the immune system and how it functions and some of the different cells of the immune system. Today we're going to briefly go over some different diseases and disorders that can result when the immune system malfunctions. So in this lesson on immune system malfunction, we're going to be going over some of the different causes of immunodeficiency. We're also going to talk about hypersensitive immune reactions as well as autoimmune diseases. So immunodeficiency is when the immune system doesn't function effectively enough to actually protect the body from pathogens. People with immunodeficiency have an increased risk of infections, and their infections tend to become more serious and deadly. Immunodeficiency can also increase the risk of developing cancer, since immune cells are the ones that tend to destroy cancerous cells. And there are three different categories of immunodeficiency. There's immunosuppression, pathogenic attack, and genetic mutations. So immunosuppression is when the immune system is not able to do its job properly because it's being artificially suppressed. This can occur as a result of cancer treatments, which inadvertently harm and destroy cells of the immune system as well as cancerous cells. And it can also be done intentionally as a way to treat autoimmune diseases where the person takes medication which inhibits the function of the immune system. Or you can have pathogenic attacks where certain pathogens attack the immune system, and that's what causes it not to function properly. A big example of this is HIV, human immunodeficiency virus, which is a virus that actually infects T cells and kills them. And as HIV progresses, it can develop into AIDS, which is acquired immunodeficiency syndrome, where the T cell count is so low that it really isn't able to do anything to protect that person from incoming pathogens. This leads to a really high risk of infection as well as viral induced cancers, which are the primary causes of death in AIDS patients. And then lastly, you can have different genetic mutations that cause disorders of the immune system. These disorders are hereditary, but the mutations can also show up randomly. One example of this is severe combined immunodeficiency. These people don't have B cells or T cells that develop properly, and so are super vulnerable to diseases. This person has to be diagnosed within a few months of being born in order to survive, and then essentially has to live like in a bubble to protect themselves. The opposite end of that spectrum is exaggerated immune responses, where the immune system is actually overactive and can be really dangerous. It can actually be just as dangerous as an ineffective immune system. And there are two different types of exaggerated immune responses. One is hypersensitivity, which is just an allergy, and the other is autoimmune diseases. So hypersensitivity is when the immune system mistakes some sort of harmless antigen for a dangerous pathogen. And so the immune system will recognize the antigen on a completely harmless substance like an egg or a peanut, and they think that it's dangerous. So the immune system creates antibodies to fight this perfectly harmless substance. The T cells can try and fight it off. The basophils will activate an inflammatory response by releasing histamine, which dilates the capillaries and causes them to become more permeable. As blood cells and water leaves the capillaries, tissues swell up. That's what can cause like the tongue and throat swelling, and it also drops the person's blood pressure. And all of that can be deadly. That's anaphylaxis, which can lead to anaphylactic shock. And then autoimmune diseases are also caused by an overactive immune system. In this case, the immune system is recognizing and attacking self-protein. So it's attacking parts of your own body, thinking that it's some sort of foreign antigen. So normally, in a healthy person, if a B cell or a T cell recognizes self-protein as dangerous, that B or T cell should be destroyed before it actually enters circulation. However, in people with autoimmune diseases, that doesn't happen, and you end up with all of these B and T cells that are actively trying to kill you, thinking that your own body is a pathogen. Oftentimes, these self-reactive immune cells only attack one type of cell in the body. So for example, rheumatoid arthritis is when the immune system attacks connective tissue of the joints. Type 1 diabetes, it occurs when the insulin-producing cells in the pancreas are attacked. MS is when T cells attack the myelin sheath of nerve cells. But other times, the immune system just attacks a whole bunch of different types of cells. So for example, lupus, where skin cells, joint, kidney, blood vessels, nervous system, pretty much all of the different types of cells in the body can be attacked by the immune system. And so in this case, with autoimmune diseases, immunosuppressant drugs are often needed in order to kind of slow down the immune system and stop it from doing as much damage to the body. You guys can watch that if you have more of an interest in allergies, but we're not actually going to go over it today. So that'll be it. That video is not required. That is just for your own interest. Everything else from this lesson, you do need to actually know though.